Hi doc, what can I do for my arthritis other than surgery? That's the question we want to tackle today. Welcome back to the channel. I'm Dr. Tinuade Olusegun, and if you haven't subscribed to this channel, you need to do so right now. Just click that button, doesn't cost anything. So, welcome back. This is a topic that I deal with commonly in my practice because I'm an internal medicine doctor and I see patients with a lot of arthritic pain. I see patients with autoimmune arthritis, which we call rheumatoid arthritis, as well as the osteoarthritis, which is basically the arthritis we get from overuse of the joint. So the main thing to understand is that regardless of whether this is autoimmune in nature or if this is a osteoarthritis, diagnosis, we do have the same underlying issue going on, which is an inflammation of a joint, right? And that joint could be the knee, it could be the hip, it could be the wrist, it could be any joint that you have in your body, right? It could be shoulders. So you could have an inflammation or inflammatory process going on in a joint, and we call that arthritis. The reason why we sometimes want to differentiate whether it's osteo versus rheumatoid is because when it is autoimmune in nature, we know that our treatment does not end with just reducing inflammation in that joint. We know that the problem started from the immune system. And for rheumatoid arthritis, we have to address the immune disease as well. And in fact, we do need to look and make sure that that patient does not have other autoimmune diseases. And that's why we want to definitely differentiate what is the cause of your arthritis rather than just say it's all arthritis, okay? So once we understand that, now what do we do to help the inflammation? Well, most patients commonly just get prescribed a nonsteroidal anti-inflammatory, which is things like ibuprofen. You might have even started taking something on your own over the counter like Advil, Aleve, and so on. Okay, these are nonsteroidal anti-inflammatory and they reduce the inflammation in the joint. But they are not a fix, right? So we also need to find out what are the things that we can do that can help our arthritis, especially when it comes to the knee, because this is one that would definitely limit your mobility, might start causing you to gain weight because now you can't do the exercises you used to do, you can't run anymore, you can't participate in like all the activity like tennis and things that you used to do when you were younger that kept you fit and in shape. Okay, so we want to address the knee arthritis, but just understand that this same concept is going to apply to the different joints like your hip and your shoulders. Okay, so with the osteoarthritis in the knee, specifically, I find that it's more common in patients that were in the type of jobs that cause them to be on their feet a long time for many, many years. Because what's really happening is that with that type of activity, you lose the cushioning between the joint, right? And then you start having bone rubbing on bone. And with bone rubbing on bone, it creates heat. And with that heat comes the inflammation. So that's what's really causing the problem in your case. In the case of autoimmune rheumatoid arthritis, the inflammation is caused because your body is making antibodies against that joint. And that attack is causing an inflammatory reaction, which is then causing the heat and causing all of the swelling and the pain, okay? So we now know you have this arthritis in your knee. The only thing the doctor is telling you is that you're gonna need surgery. And you're going, doc, I don't wanna do surgery. Is there anything I can do right now to try to help me not need surgery? It's very important that we find and start treating early, okay? So when it comes to, the options that I'm gonna give you as far as natural options, this has to be started early. You can't wait till your disease is end stage, really, really bad, you can barely move, to start implementing this. But if you do implement this at any stage of the disease, it will still be helpful, but it is better to start this early. As soon as you start having any symptoms or signs, that's when you want to start doing this. so that you're not at the point where like it's far gone, your knee is far gone, and surgery is probably one of the only options that's going to seriously reduce your pain. Okay? So one of the things I tell my patients to do is to stop the injury. Okay? So if you're someone that you've been running and you want to continue running, and the running on the pavement can definitely be too much of a high impact on that joint, and that continues to cause inflammation of that joint, and it's going to continue to cause problems. So we've got to cut back on the injury. And a lot of doctors that tell you to keep exercising, well, yes, exercise is going to be important, but we have to make sure it's not the exercise that's going to continue to inflame that joint. So what I tell my patients is, look, we have to find low impact exercises, something like swimming, something that is like you're going to be in water aerobics, right? Something like yoga, stretching, those type of exercises that you still get things moving, but you're not injuring that joint more and more, right? Or continuing to cause inflammation in that joint. So that's going to be very important. The next thing I say is to support or strengthen the support muscles. Okay, so supporting those muscles or strengthening those support muscles is going to help your knee. So what I'm talking about here is strengthening the glutes, strengthening the quads, strengthening the hamstrings, right? Those are the muscles that are going to be attached to the knee, right? And they're going to, if they're strong, they're going to help support that knee so that it is not, impacting the inflammations more. So a lot of patients start to, strengthen their quads, but they don't equally strengthen their hamstrings, and a lot of patients don't equally strengthen their glutes. Okay, so it is very important that all these three big groups of muscles are strengthened equally and they are in good balance if you're going to support your knees. Same thing with all of the joints that we're going to be, treating. If it's your shoulder, yes, all the support muscles have to be strengthened, not just one or two. You got to think about all of the anatomy around that joint that is kind of off, and start to strengthen them so that they can support that joint a little bit better. Okay, so that is something you can do if you don't want to go for surgery right away and you want to see how much you can help. Okay, so besides exercises and stopping the injury, the other thing to do is you can stop certain foods. Okay, we know that foods that are anti-inflammatory are very helpful for arthritis, whereas the processed foods and things like that are not very helpful. So I'm going to just talk about a few foods here that I will definitely tell you to avoid eating so that you can start helping your arthritis. Okay, so those will be processed meats. Okay, anything processed, in fact, you can just cross it off your list. If it's processed carbohydrates, processed sugars, processed alcohol, processed meats, processed vegetables, processed, just anything processed in front of it, forget it. You shouldn't be eating that because those foods are inflammatory to your body. They are going to cause an acidic environment in your body. Acidic environment causes inflammation, whereas what you want to do instead is eat more anti-inflammatory foods. So anti-inflammatory foods are going to make your body more naturally alkaline, right? That's going to be less inflammation to your body. So what am I talking about anti-inflammatory foods? I'm talking about things like, eating fresh fruits and vegetables, eating fresh fish, specifically fish foods that are rich in omega-3 fatty acids. So things like salmon, things like grass-fed beef, okay? Those are going to be very helpful for your arthritis. Start adding things like flax seeds and chia seeds and walnuts to your salad, right? Those have good omega-3s in them and they're going to be very helpful for your inflammation. Also, I recommend foods that are high in sulfur. Okay, so sulfur-rich foods going to be things like onions. It's going to be things like asparagus, garlic, okay? So they release a compound called MSM, and MSM is a natural anti-inflammatory, and that's why we like these foods. So those are the type of veggies that you want to include in your regimen that's really going to be beneficial. Some people believe in using bone broth, right? Bone broth is basically when you boil the long bones for hours and hours and hours to extract all the beneficial collagen from them. And this collagen includes amino acids that are very, very healing to damaged ligaments and tissues and tendons. Okay, so those are kind of the reason why we think bone broth might be a good addition to your anti-inflammatory diet to help with your arthritic condition. Okay, one of the things I didn't mention is sometimes when we start adding vegetables to our diet, we have to be very careful of nightshades. So nightshade vegetables, things like eggplants, some tomatoes and things like that, for some people, believe it or not, even though it's a good vegetable, can actually cause inflammation in their bodies. So be very careful about these nightshade vegetables. If you're not sure which ones they are, type it in Google, try to see if you might be consuming a lot of these, and maybe you want to reduce those, okay? Also, very, very important is I tell my patients things to avoid might also be gluten. You know, when they're removing the carbs and the sugars, I usually throw gluten in there. I also throw dairy in there because gluten and dairy, for a lot of patients, they are sensitive to it, and it causes inflammation in their gut, which is also going to lead to more inflammation in the joints, okay? So those are things that you can remove from your diet. I've mentioned things you can add to your diet, right? Because as we're removing stuff, we want to add good stuff, right? So we want to make sure we're balanced. So you're removing the bad stuff, you're adding the good stuff to help the inflammation, reduce acidity in your body, increase alkalinity in your body, and so that you're less inflamed overall, which is also going to be less inflamed in your joints, okay? Of course, losing weight, okay? I'm a medical weight loss doctor. I love helping patients lose weight to help with their arthritic condition. I find that, you know, we drop 20, 30 pounds, oh my God, that joint is going to feel so much better. So yes, losing weight overall is going to help with you improving your arthritic conditions, okay? So what are some supplements that you could take that will help you with arthritis? The ones I find that have been, you know, that have some good clinical data, research data to back them, things like taking turmeric, or you can find that, you know, you can get it as a spice, you add it to your food, you can get the actual root, juice it and eat it daily. You can take the supplement of it, like 1,000 milligrams daily. That has been very helpful in patients. I find that the liquid version, the activated turmeric, is actually very effective. I've had patients where this is all I use to treat their arthritis because they don't want to take anything else, and this has been very helpful. Also, I've had patients, we always add some omega-3s to their plan, so fish oils, giving them close to like 1,000 milligrams daily. That has been shown to be very helpful. We also use, in my practice, CBD or cannabidiol, right, which is derived from the hemp plant or the cannabis plant. That is actually one of the secrets that has been kept from a lot of us for a very long time. And CBD, the non-psychoactive part of the cannabis plant or the hemp plant, you can find it over the counter. You don't need a medical card or anything to get it. CBD is very helpful for inflammation in your joints. You can rub it on topically, you can eat it as a gummy, you can take it as a drop under your tongue and get it in your body. You can put it on your food and get it that way, okay? So CBD or cannabidiol, which is one of the ingredients in the cannabis plant or the hemp plant, is very, 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 very anti-inflammatory and safe for your gut. Instead of taking, you know, ibuprofen and Aleve and all these medications that can tear up the lining of your gut, CBD actually has been shown to heal or repair the lining of your gut. So I'd rather you use that as an anti-inflammatory sometimes than taking ibuprofen, okay? So some other things that I'll mention here, there's some support, not enough data. The moringa plant, I know a lot of people do swear by it, that it does help them. It is anti-inflammatory in nature. It does help the immune system, especially for those that have, you know, autoimmune disease, autoimmune rheumatoid arthritis. So moringa can be very helpful, and also the extract from green tea has also been shown to be anti-inflammatory in nature, antioxidant in nature, and being very helpful for patients that have arthritis, okay? So those are some of the things that I would usually recommend for patients that are thinking, you know what, I don't want to have to go through surgery, I'm not ready to start taking all of these harsh drugs to treat my arthritis, I want to do this as natural as possible. This is something that you can do. Foods that you can remove, foods that you can add, supplements you can take, and exercises that you can do. Remember, water aerobics, something very, very light on your joints, right? Reduces the gravity, right? And then you're supporting those muscles. the ones that support the joint that you're trying to treat, and then removing the injury. You cannot continue to do the same work or the same exercise or the same thing that caused the injury and expect to get better. You gotta rest it, you gotta find some other ways to help that joint, okay? Hope this has been helpful. If you have anything else that I might have left out that you know for sure help joint arthritis, I would love to hear about it in this comment section below. Very, very nice that you joined us today. I will see you on the next one. Bye for now.